A lot of issues on the table, of course, vaccines, the variants going around, all hugely important for South Africa. Let's take you live to Geneva.
Whether that's raising money, inspiring others, informing the public, or simply deciding to stay at home to keep others safe. The second is that Captain Sertom was a reminder of the value we should put on older people and everything they bring to our world. However, there is a disturbing narrative in some countries that it's okay if older people die. It's not okay. No one is dispensable. Every life is precious, regardless of age, gender, income, legal status, ethnicity, or anything else. And that's why it's so important that older people everywhere are prioritized for vaccination. Those most at risk of severe disease and death from COVID-19, including health workers and older people, must come first, and they must come first everywhere. Globally, the number of vaccinations has now overtaken the number of reported infections. In one sense, that's good news and a remarkable achievement in such a short time frame. But more than 3/4 of those vaccinations are in just 10 countries that account for almost 60% of global GDP. Almost 130 countries with 2.5 billion people are yet to administer a single dose. Some countries have already vaccinated large proportions of their population who are at lower risk of severe disease or death. All governments have an obligation to protect their own people. But once countries with vaccines have vaccinated their own health workers and older people, the best way to protect the rest of their own population is to share vaccines so other countries can do the same. That's because the longer it takes to vaccinate those most at risk everywhere, the more opportunity we give the virus to mutate and evade vaccines. In other words, unless we suppress the virus everywhere, we could end up back at square one. On Wednesday, COVAX published its forecast for the distribution of vaccines to participating countries. This is a very exciting moment. Countries are ready to go, but the vaccines aren't there. We need countries to share doses once they have finished vaccinating health workers and older people. But we also need a massive scale-up in production. Last week, Sanofi announced it would make its manufacturing infrastructure available to support production of the Pfizer-BioNTech vaccine. We call on other companies to follow this example. Companies can also issue non-exclusive licenses to allow other producers to manufacture their vaccine, a mechanism that has been used before to expand access to treatments for HIV and hepatitis C. The COVID-19 Technology Access Pool, or CTAP, enables the voluntary licensing of technologies in a non-exclusive and transparent way by providing a platform for developers to share knowledge, intellectual property, and data. This sharing of knowledge and data could enable immediate use of untapped production capacity and help build additional manufacturing bases, especially in Africa, Asia, and Latin America. Expanding production globally would also make poor countries less dependent on their donations from rich ones. These are unprecedented times, and we applaud those manufacturers that have pledged for example, to sell their vaccines at cost. But manufacturers can do more. Having received substantial public funding, we encourage all manufacturers to share their data and technology to ensure global equitable access to vaccines. And we call on companies to share their dossiers with WHO faster and more fully than they have been doing, so we can review them for emergency use listing. Last Friday, we heard from health workers in Uganda and Pakistan who are waiting to be vaccinated. Today, we're pleased to be joined by 2 health workers from high-income countries who have been vaccinated. First, I would like to introduce Professor Gabriel Gold, who works in a geriatric department at the Troyes Hospital here in Geneva. Professor Gold, thank you for joining us. Please share with us your experience during the pandemic and your hopes for your work and indeed the world now you have been vaccinated. You have the floor.
Thank you very much for inviting me. I must say that vaccination for me was a huge relief. You mentioned the case of a centenarian who did so much and unfortunately suffered from the disease. It's important to remember that the sickest people with COVID-19 are very often the oldest and the most frail. I work in a hospital that has provided acute care to people with COVID-19, perhaps over 600 patients since the beginning of the pandemic. These people deserve top quality care for their COVID disease, but they also require a lot of help with other comorbid diseases, but most importantly, sometimes with very simple things. It can be helping them sit up in bed. It can be helping them wash their face or brush their teeth or taking a sip of water. It can be just a reassuring presence because sometimes they may be lost or confused because they are so sick in unknown surroundings. This means that there is a very close proximity when taking care of such patients between patients who have a very serious and infectious disease and healthcare workers. And of course, we use protection, whatever we need, protective clothing and barriers and masks. But the vaccine is really a key way to prevent the spread of the disease. And of course, this is something that we worry about because we also have many other patients in the hospital who came in for other reasons who don't have COVID-19. And we want them to be able to go home without COVID-19. So we want to make sure that we do not transmit this to them. It also reassures us when we go home and we have our families, close ones, because we want to be careful too about transmitting the disease there. And vaccination is also an opportunity for health authorities to recognize the immense dedication that healthcare workers all over the world have put in to provide care for people with COVID-19. Long hours, foregoing vacation, month after month, and probably for many months to come. The health workers are there as long as they are healthy. And vaccination is a way for healthcare authorities to first show their appreciation of these healthcare workers, but also their understanding that if you want to provide care to people who really are very sick and need it, you need trained healthcare personnel. They have to be healthy, and vaccination is an important way to deal with that. Vaccination enhances the motivation of people who have worked very hard and need to continue to work very hard to deal with this terrible pandemic. The pandemic occurs all over the world. People are getting sick all over the world. People need healthcare workers all over the world. They need healthy healthcare workers all over the world. So we should vaccinate those people who are at risk so that we don't fill the hospitals and the care centers with as many patients. And we need to vaccinate, of course, wherever they are, all over the world, healthcare workers who are providing this care. Thank you.
Merci beaucoup, Professor Gold. Thank you so much, and I welcome your support to accelerate vaccine rollout globally. Now to our second guest, Cindy Fras. Cindy Fras is a mental health specialist nurse at the Hospital Clinic of Barcelona. Cindy, we look forward to hearing about your experience working on mental health during the pandemic and what it has been like for you to be vaccinated. You have the floor, Cindy.
Thank you very much for the invitation and for the introduction. Good afternoon, good morning, and good night around the world. Effectively, my name is Cindy Frias, and I'm a mental health specialist nurse. And I'm mental health nurse at Hospital Clinic of Barcelona, the Child Psychiatry Unit. And today I'm here for explain my experience in this pandemic situation and all the vaccination process. Owing to this public health emergency, Spanish hospital, and especially my hospital, the hospital clinic, had to adapt a lot of measures that include the adaptation, reorganization of clinical care units, hospitalization units, and even psychiatry units. All this change was a pressure and challenges for the nurse and all the healthcare workers. This experience and this current pandemic has caused an important impact on our emotional well-being, from the beginning and until now, because for the unexpected outbreak of the situation, the high rates transmission. Likewise, the increase of activity, the lack of staff, especially the nursing staff, led to an increase of our working hours every day. And that represented an important increase of stressor for us. Even now, I'm suffering these circumstances. For the other hand, regarding to the direct contact with our patient, the measures and the nurse have had to reduce, or limit the nursing care. The nurse has had to reduce the time less in every visit to the inside the patient rooms. We have had to use personal protective equipment for protection, and maybe this measure has caused in the nurse, and to express the feelings of fear, anger, and the sensation of less humanized care, and lower quality of care. Added to this situation, the hospital restricted or limited the family visits and the outside patient walks, and for that reasons, that measures affected the emotional well-being patient, the patient emotional well-being and the families too. However, I think it's very important to highlight, the adaptability, the cope of all the nurse and all healthcare workers, the resilience, the capacity of individuals to bounce back or cope in this new situation, despite adverse circumstances. And can be the resilience and the capacity of adaptation of this health situation. Is important can be understood as a process. That positive adaptation. To stress and adversity. In my case, I think I also adapt, to the situation as most people. Or as most my co-workers, but I have felt fear and anxiety because, for example, I have a 3-year-old son, and I live with my mom, and I have especially been afraid of infecting them, no, and I had to come to work every day, you know, and for that reason, I think I was feeling that sensation or negative thoughts every day, you know. Around the world, no, a lot of nurses have been infected, no, and many of them have died, and a lot of them were young. For example, I would like to share with you my own experience, because my own died in August from coronavirus disease, and she was a nurse, no. She was an extraordinary nurse, and she was only 51 years old. No, in fact, I'm a nurse for her, because she was my role model, and she was, repeat, an excellent nurse, and I always remember her as the best nurse in the whole world. No, and she infected while she was working. No, and she died quickly because she had a comorbidity, and she died a few weeks after the infection. She was a situation very, very deep for me, and obviously this loss increased my fear, my anguish, my anxiety, especially my mom. No, therefore I live this vaccination process like a great change, no? The enormous scientific advances in relation for my work, no? And I think it's fundamental, no? I received the COVID vaccine. I received the first dose on January 9th and the second on January 30th. And I haven't had any side effects, just a local pain in the arm. But some co-workers have experienced some side effects, no, minor side effects, no. Anyway, I have lived the vaccination experience as a lie of hope, a lie on the road. I don't know if this is the right explication or the right. I did a translation, you know, of my feelings, you know, and I see the process as reliable, considering some negative aspects, no, but I think the vaccination process is hope, no? Is hope, is faith in the healthcare system, and I think it's vital that healthcare workers around the world are vaccinated, because we need to do our work with security, no, with confidence, and we need to confident with the healthcare system. No, my family are very happy. My mom is happier for me, and my family is happy and hopeful for the future, and see the vaccination, no, the vaccination process, the COVID vaccine, as something safe, no, close, and maybe as a tangible fact, no. And I think the most of my co-workers see the vaccination process as something very positive, no, for us. And I think we need this vaccine for all the healthcare workers around the world. Thank you so much.
Thank you, Cindy. Muchas gracias. We know many people have felt isolated during the pandemic, and the work you do as a mental health nurse specialist is so critical. Thank you once again to both our guests today. We're glad both of you have been vaccinated and are able to keep doing your essential work. And thank you to both of you for the clear call you have issued for health workers everywhere to be vaccinated. Fadila, back to you.
All right, that's come out. That was a live report from Geneva, the World Health Organization holding one of its very frequent press conferences, hearing from a healthcare worker there, looking at the mental side of things, people suffering with loss. And earlier, the head, Tedros Ghebreyesus, calling on manufacturers to extend production. And this is a push right now, saying to those manufacturers, build more factories. Let's get vaccines out as quickly as possible across the globe. All right, with that, let's recap tonight's top stories.